This is the cure for cancer I'm holding in my hand. And the cure is not in the syringe. The cure is in the needle. What is in the needle? In the needle is a stent, like a coronary stent. Literally, a coronary stent was taken by two brilliant biomedical engineers, Sam Sia and Ken Shepard at Columbia University. And I've been working with them for a decade on this whole concept. And what they did, Tev, is they took a coronary stent and they fabricated it with electronics. So they put two electrodes, two transducers, and built in a little chip, which is a computer. And this stent is folded up, is present in this needle. So this stent can be injected in your subclavian vein and it stays there. And what it does is, this is the device, an implantable device we call the Stentinel. Do you like the name? Sentinel. Sam Sia came up with the name Stentinel. So the Stentinel's job is literally to stay in your body forever, like a coronary stent, and detect the first cell. How does it do so? Well, the stent will create an electric field between its two walls, or in its circumference. An electric field is created. Any cell that passes through the electrical field is going to cause impedance of electricity, which is immediately recorded as a signal on the computer or chip that is built onto the stent. So if a cell is small, it creates a small signal which is recorded. But we have shown that the first cell is a giant cell. Think of it like this: if the largest white blood cell is like 14, 15 microns in size, these cells can be 100 to 300 microns in size, because our work has shown that the first cell is really a hybrid combination of two cells that fuse under stress. So think of it, this stent sitting in your vein forever can not only detect the first cell going through, because it's a giant cell by size and impedance of electrical current, they can program it to electrocute that cell. This needle that you're seeing and the stent in it has cost $50 million, 10 years of work, just to make the stent. So this didn't happen overnight, but it is ready for prime time. Now, what is my contribution to the Stentinel? My contribution is, okay, you guys make the stent, and I'm going to identify what we need to detect through it. So in 2015, that is exactly 10 years ago, I fit my research lab with a filtration device and just started filtering the blood of my patients who have pre-leukemia, hoping to find the first leukemia cell. I would just filter their blood, and the first leukemia cell, as you know, blasts are larger than normal cells. So I thought by size. So we worked with a company from France called Rare Cells, who gave us who did a beautiful collaborative research project with us. And after filtering hundreds and hundreds of patients, we saw that there are these giant cells. What are they? And when we went to look into the literature, it turns out that people who have been working in the area have found that every single person with a solid cancer, whether the cancer is in the brain, in the ovaries, in the lungs, in the liver, these giant cells are found circulating in the blood. And they are associated with relapse and recurrence. So we also started finding these giant cells. So while the biomedical engineers made the stent, we found the cells, and now I have been collecting tissues of blood, saliva, bone marrow, biopsies, everything on my patients since 1984. Today, I have the largest tissue repository in the world of patients whose samples have been saved longitudinally as they go through natural histories of their cancer. And so I have this entire tissue repository. Of course, I've published hundreds of papers studying smaller numbers of samples from hair and made important biologic insights. But I've always saved extra samples from every single sample I take. That ultimately, when the multi-omics technology, when the right technology comes along, I want to have all the samples to go and find the biomarkers. So basically, my idea is revolutionize early detection to cure cancer. Don't wait for cancer to become the end stage disease and try to treat it, which has failed for 50 years. You've been trying, you haven't succeeded very much, except occasional successes. By and large, if you have stage 4 cancer, mostly you die. So the idea is to cure cancer, revolutionize early detection. Early detection means since no age is immune from cancer, you need to have detection available from birth to death. And since cancer is a silent killer, it can come anytime. You can't afford to do the test once a year or once every 6 months. You got to have continuous monitoring of your body, like treat the body as a machine and just monitor for everything you possibly can continuously. So this Stentinel, Tev, can scan the entire 5 liters of blood that will pass through the stent every 18 days. So every 18 days, once the stent is in, we are finding the first cell and electrocuting it right there. Could you imagine a better paradigm for any disease? And the Stentinel will be able to detect dementia, any biomarkers, because the biomedical engineers, Ken and Sam, are so brilliant. They have used this small molecule um, field electronics transistor technology also to detect small pieces of protein, small pieces of RNA, small pieces of DNA, not just large cells. They can do all of this now. So any disease is going to shed its own unique biomarkers, pick it up early and boom, take care of it right there. That's my paradigm. Henry Ford said something very important. 1909, he said, if I asked my customers what they want, they would have said a faster horse. Instead, I gave them an automobile. So I'm saying that the Stentinel is a Concorde in the time of horse carriages. And once the word processor came along, who cares about the companies making typewriter ribbons? Who cares? The whole system flipped immediately by itself. That's what I'm saying. Once this thing comes along, no matter how much opposition there is, it's going to flip the system, because if you don't want to use it here, Korea and Pakistan and China will start using it. So I think that, and I'm not some defeatist. I hope that's very clear to you, that I've been fighting the system for 40 years. And if anything, I'm more energized every day because I'm refusing to stop seeing patients. They are my real inspiration. And until I can help them, I'm not going to rest. One of my favorite books is Thomas Kuhn's Structure of Scientific Revolution. He published that in the 60s. But the point he made it very true is that there is a paradigm that exists at the moment. We tend to accept that paradigm. Currently, that paradigm in cancer is treat cancer with slash, poison, or burn. Surgery, chemotherapy, radiation therapy. That is our paradigm. So what is happening is that all our resources are being pushed into developing and supporting this paradigm, developing treatments for end stage. The anomalies that appear, for example, the treatments you are developing are failing 95% of the time. They're being ignored. The negative studies are being buried, right? So nobody wants to think that I'm investing in a company that has a 95% failure rate. But everyone wants to invest in that treatment paradigm, and no one wants to invest in this. I'm saying if I get $10 million today, within 18 months, I'll have it in people. How fast? How can you accelerate 18 months, for God's sake? But do you know what I'm meeting? Total resistance. No, oh, Azra, no early detection devices. They're not going to be funded. Nobody's interested. Well, I said we have electrocuting technology. It could be treatment also. Well, show us first. Well, to get there to show you, I need this money, of course.
Mm.
So that's the point. And I'm not asking for $10 million because I'm out there with my begging bowl. You can invest it in a company that will support me, not my company, but that will give the money for this.
Mm.
So what the point I'm trying to make is that markets have a nasty habit of flipping quickly and learning and ditching their old masters if they see that there is profitability at this end now. They'll flip around completely, so I'm not worried. And by the way, the stent right now costs $80, less than $100. So the insertion will take $5,000, the procedure. And every year you just have to pay a subscription fee of $5,000 because the data, petabytes of data every second are being generated in a cloud over your head and AI analyzed to alert the system on your cell phone. You will just get an alert on your cell phone saying a giant cell has been detected and electrocuted.
And immediately, yeah.
So, yeah. So for 10 years, you're only spending $55,000. That's it. For 10 years, 5,000 a year and 5,000 for the insertion. Compare that to $150,000 where you have 30% chance of response and 70% chance that you will be damaged physically and financially.